emergency that came up, and so we're graciously excusing him. And luckily, we've got um, Dr. Ackerman here with us. So he's going to walk us through some of this. I'll jump in as well, and then we'll definitely answer any questions that you guys may have. And we do want you to, it's a small enough group where if you just want to unmute and or raise your hand. I'm navigating this breakout from my laptop before I run over to the Bird Adams Support Society workday at Bird Adams. So it may not be as seamless as what we would normally expect with multiple monitors, but I think we'll get through it okay. So let me start with introduction. Dr. Ackerman, he is our council physician and the co-chair of the Safety and Health Committee, chair of the Health Committee. He's emergency room doc for Grady. He is also post-certified tactical physician for the Fulton County SWAT team, associate professor at both Emory and Georgia Tech, and also assistant scoutmaster, Troop 455, and the troop committee chair for Troop 29. I think.
Not the chair. No, just on the troop committee.
Just on the troop committee. Oh, wow, that's close. But so welcome, Dr. Ackerman. We appreciate you being here with us today. So I'm going to start with going through our slideshow here. We want to talk today about how we can scout safely in a COVID environment and how it's possible to execute and implement the activities that we need to put on a safe and successful program. So where are we currently as a council? We want to ask you to help us to spread the word that the COVID policies and protocols that we have in place right now have not changed. The Safety and Health Committee, we meet monthly to review and update anything, and we have a meeting coming up in 2 weeks, I believe. And we will review the changes that have happened from the state. But as far as the council's policies and protocols, they are still in effect and have not changed as of today. Safety while continuing to implement the program will be the path forward, regardless of what happens politically with varying opinions about COVID or other conditions. Our mission is to deliver the program safely in whatever conditions we're faced with. Individual activities will continue to have responsibility for communicating and implementing safety measures. So what that means, and we'll address this a little bit later in the presentation, is there are the base protocols and policies that the Safety and Health Committee have put into place based off of the expertise of all of our members, but also the guidelines from the CDC and initially from the state of Georgia. There are a basic kind of a skeleton, if you will, that we have put into place. And then each individual activity needs to cater those things to their activity, because not everything will be a one size fits all. And so where some activities have the opportunity to have large staff and to have those staff members doing various things to help their participants feel comfortable and to feel safe and to create a certain environment, a smaller activity just may not have the ability to do that, nor would it be necessary. And so it will continue to be up to the individual activities to utilize that basic framework of our policies and protocols, and then cater that to your individual needs while still following those policies and protocols. Dr. Ackerman, did you have anything that you wanted to add to that?
I don't think that there's a whole lot in terms of our policies and protocols that needs to be added. We'll talk about it more on the next slide, but this is an approach that has been working. And certainly, as Josh just alluded to, our state policies are changing to where what we recommend is a little bit more than what the state says we have to do. And I think at this point, it's sort of prudent to maintain a level that keeps our scouting families comfortable that we're taking adequate precautions that are not overly onerous, but also that we know have worked so far under what hopefully has been the worst conditions that we'll see in this whole pandemic. And then hopefully at some point in the future, we'll be able to start scaling back.
Awesome. Thanks, Doc. Any questions on this before we move forward to our next slide? All right, hearing none, we're going to take questions at the end too, so just jot it down and we'll follow back up if we need to. Doc, you wanna take this one?
Sure. So in terms of finding resources for this, on the council's website, as well as on the national website, there's a good bit of information available about how to continue doing things within the context of COVID. As always, there are going to be event-specific safety guidelines. And I would like to encourage everybody to think about the COVID safety issues the same way that we think more generally about safety issues at events. So hopefully you're using event planning tools and looking at what event-specific guidelines there are in general for most activities. And then on top of that, you would add on an area where you're trying to make sure that any specific risks around COVID for your activity are being addressed. At this point in time, the CDC website and the information there is what I think I would view as the most definitive source of information and guidelines, and that's largely what we're basing our recommendations from. And then the Safety and Health Committee has our policies posted on the council website. If there are updates, we will try to make sure that those get disseminated out so that everybody is aware of them. And then the Safety and Health Committee, both myself and my co-chair, Allison Carter, are happy to try to help out when needed with making sure that events can be done safely.
Awesome. All right. So what are some positive lessons learned? One of the first ones is scouting programs can be implemented successfully when proper precautions are used. We have done some pretty amazing things when you look back at the conservation weekend in November at the end of 2020. That day in camp, we had over 400 people in camp, and that was able to be executed without issue in a COVID environment. When you hear the individual stories from the units and and the district level activities that are happening, they're happening in person, just with modifications. But scouting programs can be implemented successfully. We have heard numerous stories, anecdotal stories of activities that are being implemented and executed just in a new and a different way, and sometimes in a better way, because it causes us to stop and think and not just necessarily do it the way that we have always done in the past. Dr. Ackerman, you want to take the next one?
So, going along with that, with the programs being successful, the protocols that we're using for safety have been working. So we have these events, we have our recommendations that by and large, our scouts and families are following. And early on in this, when we started having some of these events, I got a few phone calls here and there from Josh alerting me that somebody had called in after event saying that they had actually tested positive for COVID. And the time frame of that, it was highly likely that they were already positive while they were at our event. And initially with these phone calls, it was sort of terrifying that we were going to be the next super spreaders. And, we were going to be front page news for an event that we had tried to do. And I'm happy to say that I've now gotten a lot of these phone calls if there was an event and somebody tested positive afterwards. And we've been good about getting follow-up where we're calling and checking and making sure, but we've not had events where there have been people who have become positive as a result of attending our event. That is, we get the call from one person, we start kind of the contact tracing process of figuring out who might have been exposed to that person, and we're just not finding additional infections that are happening as a result. And I think at this point, kind of in the pandemic, that is sort of very reassuring that if we continue to follow our protocols, we can do things safely and now have a pretty good and established track record of making that work.
Good. So the next point that we want to illustrate here is that families are more appreciative than ever for the benefits that scouting has to offer. And I know that you guys probably on the call could share examples of that, but in my role as Safe Scouting and Operations Director for the Atlanta Area Council, I've heard over and over again from folks that, when other things were dramatically changed, kids weren't attending school in person, other extracurriculars were canceled, the scouting activities that were implemented were a great relief for them and a great opportunity for their children to get out and to really recharge their batteries and take a break from the stress of all the other calendar changes and all the other activity changes. When scouting was able to be implemented safely, it provided some respite from that condition. So, Dr. Ackerman, you want to finish us up on this slide?
So finally, in all of this, what we've learned, and quite frankly, is something that we already knew, and I think everybody on the call knows, in scouting, communication is extremely important and is the key really to making everything work. About COVID specifically, communication is important so that scouts and their families understand ahead of your events what the policy is, what the precautions are for those who are maybe a little bit cautious about going to something, clearly describing what you're going to do to help keep people safe. For those who maybe are less inclined to follow some of the restrictions so that they understand what the expectations of them are before they get there. During events, if something comes up, obviously communication becomes important. And after the events, having people self-monitoring if they have symptoms, if there's concern, making sure that that's getting communicated back to help us to track back and make sure that we understand what's going on. Although this is COVID specific, this is the same thing that you want to do for any other aspect of a scouting program. Communicate what to expect, what people need to do, and make sure that people are communicating afterwards if there was a problem or something that needs to be addressed for the future. It's just the added little thing that we need to be a little bit extra cautious about that communication now.
Awesome. So we wanted to provide adequate time for any specific questions, but we've pre-populated a couple here that are questions that we regularly get. So we'll go through these questions. I want to take an opportunity to take you guys to the website also and show you where you can find some of the resources that we talked about previously, and then we'll be available for the next 15 or 20 minutes to answer any questions that you all may have specifically about this topic. So the first one that we hear often, and I think Dr. Ackerman and I will tag team this one. But how do we respond to unit members or activity participants that are not following protocols? So, Doc, how do we do that? What should I do if I see somebody that's not doing what they're supposed to?
Well, and the reality is this is similar to somebody not following other rules. So before we even get to enforcing the rules, we need to make sure that it has been clearly explained ahead of time what the expectation and what the protocols are. You may be hearing a few gunshots in the background. I'm here for an open shooting day at Burt Adams, and on our ranges, it's very simple. We do our range briefing. We explain to the scouts what the rules are on the range. And on a shooting range, if you don't follow the rules, at some point you are asked to leave. And to a degree, following the COVID protocols, that really is where we need to be. I think that you should be politely asking people and reminding them of what the protocols are. So if it's you need to be wearing a mask, people need to be reminded. People do sometimes legitimately forget. And so it's appropriate to remind people politely and encourage them to actually follow. But at some point, if people are not, they should be asked to leave. It becomes a little bit more challenging when there's a larger group of people there. And I think that we need to tell our families that if there's something that's making them uncomfortable, it's okay for them to leave. But at the same time, anytime somebody is leaving or being asked to leave, we need to have some communication about what happened afterwards, whether it's to the leader of an event, just to try to figure out what happened and if there's some way that we can improve afterwards.
Yes, and just want to echo what Dr. Ackerman said, that it's an old adage, and we know that sometimes you can have a failure event when it's everyone's responsibility, then it becomes no one's responsibility. But this is one of those situations in scouting where it has to be everyone's responsibility. The reports that we hear back later after an event, well, Josh wasn't wearing his mask and that made me uncomfortable. While I appreciate hearing that so that I can follow up with the leaders that are executing those activities, it doesn't help us with the basic, premise for why that policy or protocol is in place. It's to keep people safe. And like the example that Dr. Ackerman shared about the shooting range, we wouldn't want to react after the fact to an infraction or a policy breach on the rifle range. No, we would call ceasefire and we would stop that activity and make that correction right there. And it's same is true for a COVID environment, that risk, that threat is real, if only in the minds of the participants, which is a valid thing. We want people to feel comfortable while they're at our activities. And so that's why we publish these policies and protocols, and we do expect that even though sometimes it may feel burdensome, it is your responsibility to speak up. On the youth protection side of things, we talk about being an upstander. And this is a situation where we all have to be upstanders. And thankfully we've done a really good job. Scouting has done a really good job of communicating with one another and saying, hey, I noticed you don't have your mask on. Would you put your mask on? It helps me and my scouts to feel more comfortable while we're here. Would you do that for me? Most times you're going to get a very positive reaction when you approach it in that way. Did I miss anything, Doc? Anything else on that question before we go to the next?
No, I think between us, I think you managed to fill in the things that I was realizing I had left out.
Okay, well, let's go on to the next question then. How or what can we share with parents to ease their concerns? And Doc, I'll let you start again with this one. Just what should we be telling our units, our parents, those folks that maybe feel uncomfortable coming to an activity? What can we share with them?
So I think, first and foremost, it's important to share that we have been doing Scout activities over the past year. We've done events like the Conservation Weekend. We've done things like Winter Camp. We've had Cub Scouting events at our camps where we've actually had fairly large groups of Scouts and Scout families coming together with controls in place without having problems. And so I think that becomes one point of reference, the point of what we have already done, and reminding them that there are policies and protocols that we're following that have been working already. I think echoing some of what Josh said in terms of enforcement of some of the policies and protocols, being able to articulate that we are trying to do these things for everybody's sort of comfort and safety, and being able to tell folks who are concerned about what it is that we're actively doing, whether it is making sure as a unit is starting to meet that you're meeting exclusively outside, or maintaining distances, wearing masks, temperature checks, having extra hand sanitizer, whatever it is you're doing to make sure that you can articulate to people of concerns how you are taking steps to try to help keep everybody safe. This sometimes turns into a little bit of a conversation, and particularly on a unit level, sometimes it's important to hear some of the concerns that you might get feedback about as you try to explain what you have planned to keep everybody safe. So for example, if somebody is a family member who's on chemotherapy, and therefore there's a little bit more concern for that family, to try to have a little bit of a discussion about whether there's something additional that's reasonable that within your unit you might be able to do to help them feel more comfortable and safely participate. I think that particularly at a unit level, being kind of open and aware and having the conversation so people can air their concerns and then be able to point to what we're doing to address it may be helpful to get people to feel a little bit more comfortable about coming back into things.
Awesome.
Josh?
Yeah, good. That was really good. All those basic things. Communication comes back to communication. And while it would be nice if Dr. Ackerman and I could talk to every single unit leader and get in front of every single scout and scout family, that's just not realistic. This communication has got to happen by the specific event or at the unit level, at the family level. These policies and protocols, the actions that you're taking to keep their family safe, we depend on you guys to communicate that information. And if you have questions, then we can work with you, and we can be a resource to help fill in any gaps in your understanding, or if you have any questions, so that you can more accurately communicate with the folks that you're responsible for. So let's move on to the next question. Doc, when will these conditions ease? When is this going to be over?
As I told somebody earlier today when they said, well, what's it going to be like in 6 months? My answer was, I'll tell you in 6 months. We're sort of at a point where we have a number of things that are encouraging. Our overall caseloads have gone down, although unfortunately over the last few days, we're seeing a little bit of an uptick. And based on what we're seeing in other states, there's reason to be concerned that we may be in Georgia be seeing an increased number of cases. We are the state with the lowest percentage of our population vaccinated, which means we are furthest away from getting to some level of community protection from the vaccination. And then, of course, we've got the wild card of these mutated strains that are appearing. And so far, for the most part, there's not a substantial difference in terms of infectiveness, with an asterisk between strains. We think that our vaccines will provide significant coverage, and that people who've already had COVID are at lower risk from the newer strains. But that's the strains that we know about and have identified. And unfortunately, with these mutations, it's hard to predict what's going to happen next. So my kind of hope and dream is that 6 months from now, we may not even be recommending wearing masks except for highest risk people. That would be my hope. And kind of the nightmare is that we are back where we were a few months ago, with extremely high rates and overfilled hospitals, and having to kind of be very cautious about what we're doing with large groups. I don't think it's safe to predict when we're going to be out of the woods right now, unfortunately.
So, but Doc, the state just came out and rolled back all the precautions. That must mean that things are okay, right?
Unfortunately, this is where, when politics meets public health, it's hard to know. It's a decision that 6 months from now, the state rollbacks may look incredibly smart, or we may be regretting them in a pretty big way. And it goes back to I'll tell you how it turns out. How's it going to be in 6 months? Well, I'll tell you in 6 months. We won't know until we really know. So I that's part of where, as Josh articulated, our consensus has been that even though we're having easing and other things like that, as scouts, our role really is to go with what has been working, to try to look towards the experts like the CDC and our public health folks and try to do the right thing, even if it's not a legal requirement. So that's kind of how we came to where we'd like to see people going. We feel like it's the right thing to do for our scouts, for our scout families.
Good, thank you. So our final question on our pre-populated questions from folks that we hear often is, how do we respond if a participant tests positive? And so I'm going to take the answer on that one, and then Doc, if you want to fill in with anything that I missed. But so what do you do if a participant tests positive at one of your activities or a unit, a function? What we ask you to do is to be sensitive to the idea that we want to have the best possible outcome for everyone involved, but we want to be respectful and protect the privacy of those involved as best we can also. And so what that means is, when someone tests positive, we ask that the unit leadership or the activity leadership reaches out to myself, the director of Safe Scouting, and that we address that. I'll work with you if you're the leader, or with whoever that leadership person is, and we will talk through the events that happened, where this person participated, who was directly brought into contact, and then that second sphere of those that may have a secondary contact or more of a peripheral contact. And so people might ask, well, and that's what has happened. We've had a few incidents like this. They say, well, I want to know, and I want to know their name, and you need to tell me their name. And there's a line in there where if we, through that unit or activity leadership, determine that you were directly brought into contact with this person, then you will know who it is and what happened. and where they were at so that you can take the appropriate measures. If not, then you're in that second level, that second layer, and you're going to be made aware that there was someone who tested positive that you may or may not have come into contact, and we believe that you did not come into direct contact with this person, but they were at an activity that you were at. And then we'll ask you to monitor your symptoms and to go get tested if you feel like that you may be sick. And then we want to hear back from you as well. And that's why we do that, is that first level, we want to protect those people, but we also want to hear back so that we don't become a super spreader event to where we're the genesis for a large number of people testing positive and having, what could be a cataclysmic event for a lot of lives. We have seen this procedure work. We've had activities, I won't call them all out by name, but we've had a handful of activities that have had someone on the following Monday report, hey, I wasn't feeling very good, went in on Monday and got tested, or Tuesday got tested and tested positive. And so while we don't know that they were positive and able to spread the virus while they were at the activity, chances are that they probably were. And so then we go into action and we do this communication that we talked about. Now, again, while we're not research scientists, well, Dr. Ackerman probably has done some research, but I'm not a research scientist. And so I don't know 100% every detail about the infection rates and the spread and all those things. I can tell you that we have not had a super spreader event. We have not even had any community spread to my knowledge. The 4 or 5 incidents that we've had where someone has tested positive, either during or immediately after a scouting activity, no other reports, and we follow up at 7 days and at 14 days with participants and request that you share back with us if you tested positive, if you're not feeling good, any unusual conditions. We've had no reports back of any community spread at any of our activities. So that's a really positive indication that some of the questions that we answered before, that our policies and protocols are working. What you guys are doing is making scouting safe, and that we can execute in the COVID environment, regardless of maybe what other organizations are doing or what other things are happening. We're able to do it. Doc, did I get that? What else would you add to that?
No, I think you hit all the high points, and echoing this theme around communication, clearly communicating that, as an event organizer, you want to hear if somebody's getting sick so that we can investigate and keep everybody informed appropriately. There's a fine line in these sorts of events when somebody gets sick of, communicating information that ought to be kept private, but making sure that everybody's adequately informed. And so, in most instances, the knowing who it is doesn't really make any difference. From a staying healthy perspective, if an exposure happened, it's already happened, and it doesn't really matter who it came from. There's nothing that anybody should be doing about that other than wishing that everybody gets healthy and stays healthy. So, the communication about, we want you to share if you're having symptoms, provide feedback if you end up testing positive, and being clear that if there is an event that happens at your event and somebody tests positive or gets sick, that the community will be alerted that something happened, although the details may not always be quite as much as what some people would like.
Awesome. Thanks, Doc. So we've got a little bit of time left. I want to walk through the website and just screen share and show you where some of these resources are at that we talked about. But we really, purposefully allotted a little bit of time so that we can answer any specific questions, general questions from the attendees. So I'm gonna stop sharing this slideshow now, and we'll just open it up for questions for the next few minutes.
I'm interested in seeing the resources, and until the tour, I'm not sure I'm going to have any questions. Tour the website.
Okay. Anybody else?
Gosh, I get a lot of questions about, what is the council doing about summer camp? Is it going to be safe? And do we share those resources? I mean, what's the best answer to, because some may be still on the fence about sending their scouts to camp. How do I assure them, yes, we're having camp, definitely. We're putting protocols in place. And do I share those resources with them and say, this is where you go for any, questions to make the parents feel comfortable sending their scouts to camp this summer?
I think that sort of falls a little bit under the question that we had on the list, about how to reassure folks in general. I think part of it is, again, to point to things like the conservation weekend, and actually winter camp effectively was a dry run of summer camp. And that actually happened at hopefully a point in time where it was much higher levels of COVID than what I'm hoping we will have during the summer. And it was able to go by safely. So I think that's an important thing to point out in time. I think that the resources that Josh is going to show you are very reasonable to share with people. I will say there are some people that, they're going to continue to be concerned about this, and you may not be able to convince them. My approach with most people is more towards, here are the reasons why I think it's okay. I can't tell you with a straight face that there is no risk to doing these things, right? It's just like a great many scouting activities, whether it's going on a hike or setting up an axe yard. It is possible for something to go wrong. And certainly with COVID, we know we've seen super spreader events. So I'm pointing out and saying, we can't make this zero risk, but we think what we've been doing is very good. And we can point to events that, the council has already done that have helped. Hopefully we'll get people a little bit more comfortable, but there may be some parents where that's just not quite going to be enough. Encouraging folks to come out and see things, and have some parent participation. So demonstrating using some of the protocols at unit meetings and kind of go on, the kids can, for the most part, follow the guidelines. And our unit can take some responsibility for keeping everybody safe. And hopefully that helps spread some confidence that when we go to a summer camp where it's multiple units, that we're all looking out to protect each other. And I know that there are some parents in units that I work with that, their scouts only come to our virtual events. They're just not ready to do anything in person. And I don't think there's anything specific that I could say at this point that would convince them. And we found over the last few months, as the scouts have gotten into virtual school fatigue and all of that, as we've continued to say, look, here's what we're doing to try to keep everybody safe, we've had a steadily growing number of scouts and their parents kind of coming out. Often parents are coming with their scouts to the first in-person meeting or two to kind of get a sense of, is this really okay? And then we're a little bit more back to where they're letting their scouts off and run off and have our meeting, and not having the parents hovering as much as they get comfortable with what we're doing.
Thanks.
Good.
Yep.
Good question, Mary. Thank you. Any other questions before we look at the website? All right. Well, I'm going to share my screen, and I'm going to go to the council website. Got to rearrange because I'm working one screen here. So when you go to the Atlanta Area Council and go to Youth Protection, I don't know if the screen share is keeping up or not. I'll try and do that. You go to Youth Protection. Underneath Youth Protection, there's a tab that says Health and Safety. So I'm going to click on Health and Safety, which was already at, and then we've got a menu here on the right, but we've also got trying to get the pictures out of my way here. Minimize that. Okay, there we go. So we've got the COVID-19 update. And then underneath that, we've got guidance on unit, district, and council meetings and events. When we click on that, we've got a narrative here, which we understand that we need to update based off of what the state did within the last 10 days. Because we quote executive order in here, but again, Dr. Ackerman, definitely speak up if I'm misspeaking, but it's the intention of the Safety and Health Committee, as far as I understand, and I'm their professional partner for the Scouts, that we are going to continue to require the same policies and protocols that we have in place right now.
Yeah.
Go ahead, Doc.
Yeah. Again, at this point, from a public health standpoint, it doesn't appear that we're at low enough levels that us loosening our protocols that have been working is the right thing to do. We just no longer have the state telling us that we have to do it. So this is very similar to what I think we're going to continue to see in a lot of businesses, where they're still going to have their signs up saying wear your mask, wanting to stand distances when you're in the checkout lines and things like that. And part of what you'll see with the business, and I think part for us, is that it is what people are in many cases more comfortable with. And again, we know that it's been working. So until we're at very low numbers and there's not substantial risk from bringing people together, it's a safer approach.
Thanks, Doc. So as you go through here, I'm not going to read it all, but it says, we encourage all scouting leaders to stay connected to your families at this time. Work with them to understand their interests, willingness to gather together, and create plans that meet prescribed policies to continue delivering scouting to our youth. And that's been our guidance from the beginning, all the way up to now. It still holds true. So the next category is guidelines for drafting programs and amending procedures for COVID-19. That's the information that we talked about, that we have this framework from which you have to work, you have to be compliant with, but really it's up to the individual activities. We're not going to tell you that you have to meet at a park underneath a pavilion, but maybe it's the front yard of the church, or the American Legion, or wherever your charter organization is, wherever your unit meets. That will be up to you. Down here at the bottom, there's the 2021 risk statement. That's just a letter that says that the participants in your activities understand that you're going to take every precaution that you can to keep them safe, but that they still may be exposed to the coronavirus. Then we link the guide to safe scouting, the pre-event medical screening checklist, a couple of other resources here too: Safe Open Checklist, Safe Project Tool Use Guideline, and the Safe Service Project Planning Checklist. Those aren't necessarily specific. The 3 SAFE documents at the bottom aren't necessarily COVID specific, but what they are is they're new resources that just because we're focused on the coronavirus, we don't want to stop being focused on the other things that we need to do to keep people safe. And then we have our frequently asked questions. Can we take our unit camping? Can I rent program equipment? So on and so forth. It's just the questions that we have gotten regularly over time from our scouts. And then there's just some other things here, digital safety. We implemented the SendSafe software so that you could share private information back and forth with Donna, our registrar, for registration purposes or recharter, things like that. And then just the kind of the housekeeping stuff with the hours for the volunteer service center and so on. That's what I wanted to share with you guys. Are there any specific questions about this page and any other things that we've talked about at this time? Let's stop sharing then so I can see your faces. All right. Michael's got a thumbs up. Awesome. All right. Well, we encourage you guys to please keep scouting. Do the great work that we know you're already doing. Obviously, by being here, you're interested in doing things to keep scouting going and to help kids change the course of their lives forever in a positive way. If there are any other questions that maybe you didn't feel comfortable asking in this format, shoot me an email or a text and I'll respond. And then I'm going to turn it over to Dr. Ackerman for the last 2 minutes and give us our closing argument, Dr. Ackerman.
Our closing argument. So, hopefully, as you look through the documents, one of the feedback that I've gotten from some folks looking to plan events is that there's not enough super specific information. And I think Josh kind of hinted around this, that the way to implement and do things safely in a way that works for your units, for your districts, depends a lot on where you are and what you're doing specifically. And so, the basic framework of having masks, maintaining distance, cleaning things off appropriately, will continue to remain the core of what we need people to be doing in terms of COVID-specific requirements. But exactly how you implement that really depends on the activity. And it depends, you have a big parking lot you can use at a church to stay outside versus a pavilion, versus maybe your unit isn't that big and there's a big enough indoor room that everybody feels comfortable using. So we've tried to avoid diving too deep into the specifics, and I would nudge towards thinking of COVID as one more thing in a safety plan, right? So if we've got a specific activity, you have to look at where you're doing the activity, what's involved, make sure there's appropriate safety equipment and appropriate precautions. And COVID is just one more planning element. And the things that we've all been hopefully doing over the past year have really remained unchanged. It's just that more of us are getting out and getting back to doing scouting. And hopefully we all keep on going.
All right, thanks, Doc, and thanks everybody. We'll dismiss now, and you guys can head on to whatever event you've got next. So keep on scouting.